Okay.
All right.
Sorry.
No, it's okay. So these are your x-rays, right? The osteotomy is where we picked up the tibio-tubercle and shifted it over.
Right.
Those are the two screws showing that it's in place there. And we look at a lateral right here, and this is where you really can kind of see what we did.
Yeah.
So we cut underneath it. We medialize it, bringing it more this way, and then also kind of anteriorize it a little bit, so picked it up a little bit.
Okay.
And so those are the screws right there. Okay. What we're waiting for the course of this next 6 weeks, as far as the weight-bearing status stuff, is for the osteotomy to fill in. Because essentially it's kind of like a fracture. Yeah,
Right.
we fixated it, but it still needs to fill in with bone.
Right.
Okay? Alright, so that looks good there. So let's look at your pictures. These, what'd they do? Did they send you 2 sets?
No, you wanted to see the old one, so this is the new one,
Oh, okay.
I think.
Yeah, these are
that's the new
from
one.
a 4-4, and these are from
July.
7/29. So let's kind of go to the money shots. This was what we saw initially on your cartilage injury there. See all of that
That's the
cracking?
kneecap,
Yeah,
correct.
underneath the kneecap, the patella. And so here he's using a probe to show you how deep down in there that goes, right? This here is where we were harvesting the cartilage from the intertrochlear notch, an area where you don't have to have that cartilage. We take that cartilage off when you were doing the ACL anyways, okay?
Right.
That's what we sent off to the lab, and there's a little piece of it there.
Right.
That's what helped us grow it, okay?
Right.
Here it's kind of showing how you were tracking laterally. This should be a little bit over more to the middle side.
Yeah.
So that was from the previous. Now let's look at what we saw when we went in this time. You know, so here again, underneath the kneecap,
More damage.
yep, that's some full thickness cartilage injury there, right there. But when you probe it, it probes down to full thickness.
Right.
Okay. Looking at it from another angle, here's in the trochlea. The trochlea looks good. These gutters here are clean. There's no loose bodies in there. Here he's looking at some of the condyles, and the meniscus look fine. And then normal ACL, meniscus okay, normal condyle, meniscus, and we're going to end up coming back here to this. All right. So once we opened up the knee and inverted the kneecap and turned it over, we cleaned out all of that bad stuff.
Right.
To this. That's a very sizable portion of the kneecap. Initially, it was probably about half of that, and then we're looking at it like, you know, the rest of this really does not look all that good. And they're taught with this procedure that if there's an area that's kind of questionable and you're thinking, should I do this part or not? You probably should, because it may further degenerate and then you got problems.
Right.
So we just took all of the area of cartilage that was not healthy.
Okay.
Cut it out, right? Now this is after we've put the implant in there, the MACI implant.
Okay.
So you can see that pink there is all the way down to bone.
Right.
We put some fibrin glue called to seal down over it, and then we put the patch. Remember that patch is impregnated with those new chondrocyte cells that came from you, right? And so that's it. So then we flipped the kneecap back over, and then we finished the procedure with the osteotomy. We actually did this part first.
Okay.
And so then we cycled it, moved it back and forth, flipped it back over to look at it. It was all still there, all intact, all doing great.
And you said something about I had a fracture in my tibia at some point?
I think he had done some microfracture to this spot right here.
Okay.
You see that small little part right there?
Yep.
That's some chondromalacia wear of the cartilage on the tibia.
Okay.
All right. That area was so small and a hard to get to spot that we didn't feel like we were going to be able to treat it appropriately with MACI.
Right.
And so what he did was microfracture. So took some K-wires and drilled some holes through that down into the bone to encourage it to bleed a little bit and fill in.
Okay.
Right.
Makes sense now.
That's what it was, yeah.
Okay. I was like, did I have a fracture in my tibia?
Microfracture, yeah. There's that for you, okay. So now, we talked about the whole weight-bearing status, right? That by 6-week mark, you can be full weight-bearing with MACI, right? The TTO is kind of one of the things that kind of puts a little bit of a damper in that. I still think by 6 weeks you can be full weight-bearing. Did you get to go, did they, the protocol book?
Yeah, actually I have it right here.
Yeah, in there. Where's that page? I'm looking for it. It's right here in the front. Yeah, this one here. Talking about the weight-bearing status here. So week phase, yeah, your patellofemoral, so we're less than 20% weight bearing. But as we progress along, you can see here 2 to 3 weeks, or 20 to 30%, and then up to 50% by week 3.
Right.
Okay. So the therapist is going to kind of help educate you on how you transition that. Okay. So 50%, if you think about it, 0 is my foot's completely off the ground.
Right.
50 if I'm standing with both feet on the ground and kind of even weight between there.
Right.
But I would still maybe kind of favor it just a little bit.
Yeah.
You know. So the nice thing for you is though, because it's the patellofemoral joint, not like on the condyle.
Right.
Condyles where most of our weight is forced through.
Right.
Where our patellofemoral joint sees a lot of the weight is with bending, flexing and extending, trying to go up and down stairs,
Yeah.
squatting, things like that. Okay? So this book, when you go to therapy, you just...
Yeah, I took it with me last week because whenever I guess there's some misconfusion about understanding for me about when I could start. So I went that Friday after, and they're like, oh no, not yet. But so he made copies of that.
Okay.
So,
yeah, so we usually start after the first post-op.
Okay.
I'm sorry for miscommunication.
Yeah, no, it's alright. When I called, they're like, oh yeah, he wants you to start immediately. When I called to make sure that the referral was already in the book, they're like, yeah, we want you to start immediately. I was like, okay, so I wanted to make sure the referral was there.
It's okay to start immediately. Most of the time we have people start after the first post-op visit just because some people are not ready to start moving around as much as they want you to as far as pain controls and stuff. So brace, we keep you locked in an extension like this till your next visit at the 6-week mark, okay? I can have them come and refit it to you a little bit so that it fits your skeleton more. You don't have that big bulky dressing on there. It can come off for bathing and showering.
I'll just wrap this area, I don't have to put it
Yeah, you actually don't even have to. This can all get wet in the shower, water can run over it. The steri strips will last for probably about another 5 to 7 days. Okay. And as you wet, dry, they'll start to lose their stickiness and start to peel up and
almost like a C-section.
Ice and elevation.
So, yeah, ice was almost pointless with all that stuff on there.
Yeah.
I didn't really feel any of it, so.
And then the motion machine.
Yeah.
6 hours a day.
Still at the 40, and it never goes beyond 40%, right?
Actually, as you guys progress with range of motion and therapy, then you increase the motion of the machine.
Okay.
So say you get going in therapy and they get you to 70 degrees, then you want to adjust the machine to be doing 70 degrees for 6 hours a day.
Do I need to have that adjusted by the company, or?
It should just be a little turn dial.
We gotta adjust it.
Oh, you know it? Okay.
Yeah, there's just a little turn dial on there, you just turn.
Okay. I
If
forget
you have,
they told him everything.
if you have questions on it, just call that number on there, and they'll be more than willing to come by or talk you through it on the phone. Okay.
And what do you? I have a friend that has had a TT transfer done. Apparently, and I didn't realize that she ever had that done until after this. But she mentioned she had a freedom leg.
Freedom leg.
It's like a brace.
I don't know exactly what you're talking about, but I'm suspecting that you're talking about a device that attaches to your leg so that you can put weight across it and bear on it. Does that sound right?
But it's almost like non-weight bearing. Is kind of what she said.
Yeah, from what I remember, it's almost like, okay, you can't put weight down on it, but you have your knee bent back and it's a device that straps to the end of you here, and you can walk on it. Is that what it is?
I don't know.
Using the end of your knee to do that.
Well, that wouldn't make any sense.
No, I wouldn't want to do that because when you do that, where's your kneecap go?
Yeah.
Right there.
Yeah, that wouldn't make any sense. So I wonder.
Well, I mean, I can Google freedom leg and see what it is. I'm thinking that that's what it is. I've had someone ask me about something like that
really
before.
weird. I don't know. She mentioned it. She just said that it was awesome. So.
Freedom leg. Yeah, that's what it's looking like to me. I'll pull up the
Freedom leg for you.
And that's fine. I just
yeah. See how they have something like this.
Okay.
This is what someone asked me about before.
Okay.
But that's still putting weight bearing
that
across
doesn't
it.
make any
This
sense.
is a device that could be okay for somebody who has, if you can notice in the background, she has a boot on her ankle or foot, so they've got something going on down there that they can't weight bear on that.
I wouldn't imagine that was what she was using.
Not for a TTO, I would. Well, I wouldn't have even for a TTO. You might ask her, what exactly was it that you had? She got a picture of it. Most people do just fine with kind of the crutches, and used to we didn't let people put any weight on it for 6 weeks, but now we're starting to light up on that. Questions? Refill pain medicine?
Yes.
Yeah.
I
Percocet and Oxy IR, right?
yes.
Did we do 5 or 7.5 on the Percocet?
You did 5.
5, okay. That's still working okay?
I mean, yeah, it works. It seems to work fine. I think.
Alright, I can get a refill of both of those. Remember, no anti-inflammatory though.
Yeah, and that now Fiorinol. That was a question I did have.
Yeah,
it has aspirin,
in
so
it.
I didn't think I could take
I
it.
tried not to.
Okay. Well, I've been using ice packs when I get headaches. 'Cause
What if you
sometimes
take Fioricet?
We do.
Fioricet doesn't have aspirin in it, it has
Tylenol.
Tylenol in it.
I can do that. It's just my doctor. I was using Fioricet for a while. My doctor switched me over to
Switch you
Fiorinol.
over. Yeah.
So, and I just use that. I mean, I've not been taking any of it just because I wasn't sure. So I just use an ice pack because sometimes laying on the couch all the time, not being able to move, pain medication on itself,
Yeah.
and I get a headache.
Yeah.
So I'm like, oh, this is awful. So, okay. So I might have some.
Yeah.
See how that-
The chondrocytes, the new cartilage cells that are in there, they need the inflammatory process
Right.
to grow. So, yeah. All right, I'm gonna go tell Blair to come in and kind of refit your brace for you.
Okay.
I'm gonna write a PT script just in case they need it for some reason.
I think they will
Okay.
because they didn't get it.
Yeah.
And that's why they called. And I'm like,
Yeah,
wait, why is
I'll
she
write
there?
that PT script. You've got the protocol there,
Mhm.
and then we'll see you in 4 weeks.
Okay. Great.
If any questions come up between now and then, just give us a call.
Okay, and so it can get wet. She was saying not to get it wet, but
Yeah, it's fine.
so I can get it
Yeah,
wet. And
all the
don't worry
sutures
about
are underneath the skin.
it. Right.
Yeah.
Okay. Except for the 2 on the outside that she
And
took
she
out.
took those ones out
Yeah.
already. Yeah. Okay, guys, hold on a second. We'll get it for you.
All right,
It's good to see you.
Thank you
Glad
very
you're
much.
doing well.
Yeah, I appreciate it. Great
Good to see you, sir.